Hey everyone, my name's Kim Haney and I chose to focus my community resource audit on medical transcriptionists because I feel as though this particular community is underrepresented in both the literature and in other resource guides that I'd found for medical personnel. So I thought it would be interesting and a bit of a challenge to create something that members of this community would find helpful and be able to use in their everyday lives. So just to give you an idea of what medical transcriptionists actually do, they're also known as healthcare documentation specialists and healthcare documentation editors, and they are the ones who are responsible for creating the documents that go into your legal medical record. In recent years, there's been a surge in patient volume in the healthcare system, so MTs that are able to produce timely and accurate medical reports are more needed now than ever before. However, rising costs have led many organizations to outsource their transcription work. Combine this with the implementation of the electronic health record, and they have drastically changed the field of medical transcription. There is an uncertainty now within the field, and this has stifled growth despite there being a huge need for trained professionals in this line of work. The literature review was challenging because there's a lack of literature specifically about MTs. However, thankfully there's a wealth of information about doctors and nurses, and their needs and behaviors are similar enough to those of MTs that I was able to apply that research to my community. The needs and behaviors of transcriptionists will vary wildly depending on a few factors. First, the work environment. So whether an MT works for a rural hospital or a national transcription company, for example, will influence what kinds of information they look for and which sources they turn to in order to find that information. Another factor that influences their needs and behaviors is their level of experience. An MT just starting in the field may require larger amounts of information, while someone who's done transcription a number of years won't require that same amount. And finally, demographic information such as geographic location plays an important role in behaviors as well. An MT living in an urban area will have access to more local resources such as libraries and may utilize those resources than an MT living in a rural area. What's interesting about medical transcriptionists, and this is actually what originally drew me into this community, is that their information needs are so varied, arguably a lot more so than those of the doctors and nurses that are featured so prominently in the literature. MTs need to know very specific information, but on a wide range of topics. So it was challenging to find resources that were broad enough to cover all the different topics relevant to transcription work, but deep enough to provide those specific answers that MTs need to produce accurate medical reports. And transcriptionists are often working under short deadlines as patient care is dependent on the timely delivery of these reports. Oftentimes, treatment can't begin and patients can't be discharged until a report's been transcribed and entered into the record. So it is absolutely critical that MTs have access to resources that they can access easily and quickly find the information that they need. For this reason, sources such as dictionaries, encyclopedias, and indexes, and bibliographies are the most popular source types among medical transcriptionists. To conduct a needs assessment, I would use a qualitative approach in order to better understand what MTs most commonly search for, how they search for it, and how they decide what sources are the best to answer their specific questions. I'm fortunate enough to have direct access to a member of this community, so my chosen methods of assessment were influenced by the ease of implementing these methods in my current situation. First, I would conduct an interview with a member of the community to establish a baseline of sorts. After seeing the results of this interview, I would use the participants' answers to generate an online survey to be sent via email to the participants' colleagues. This would be a relatively small sample size, approximately 45 individuals. An additional method that I think would be interesting to use for this community is to keep a diary. I would request participants to keep a record of the various information needs and information-seeking behaviors they exhibit throughout their workday. They would record what information they're looking for, what sources they consulted to find the information, and why they chose the sources that they did, so long as it doesn't violate HIPAA and confidentiality laws, ideally over a 2-week period or longer. Of course, keeping this sort of detailed record is time-consuming and may not be possible for members of this community to do because their profession puts such pressure on them to complete these reports in strict time constraints. Therefore, participants will receive compensation if they complete the diary. After all this data has been gathered and compiled, major themes will be pulled, and hopefully we could know more about their common information needs, what selection criteria they use for sources, and the types of sources that they most often use. These are a few sample questions from the interview and survey that I created. I wanted to make them open enough so MTs could include as much information as they felt comfortable disclosing, but not so open that it discourages response or encourages irrelevant information. Also, I found with those sorts of closed questions, they can lead to an automatic response, just choosing an answer without actually reading the questions. And I want to lessen the likelihood of that happening as much as possible. So to give you an idea of the types of resources that can be found in my guide, I've included a few here. I included a total of 5 dictionaries, encyclopedias, and indexes that cover a wide range of topics, including drug names, medical terminology, surgical equipment and procedures, and health conditions and diseases. Directories are particularly useful for MTs, and I included directories of hospitals, nursing homes, and physician directories as well. MT Stars is an extremely valuable resource for transcriptionists. It's an online forum that allows MTs to network with one another and discuss important issues in transcription and ask questions about topics they're unsure of. I feel like this resource in particular is more important than others because many MTs work remotely. That is, they work from their homes. They don't have access to coworkers in the same way that you or I would in a normal work environment. So this provides a level of social interaction that they don't get in their normal work environment. The library catalog that I included was WorldCat, and the reason I chose this catalog over others is because I didn't want to narrow my focus to transcriptions in a particular area, and I didn't want users from, say, Kentucky, for example, to not use a catalog from St. Louis or Chicago or New York because they think, well, that library is nowhere near me, they can't offer me anything. So I chose WorldCat because it lists all the libraries local to them, and even if no libraries near them have a particular item, they may be able to borrow items through interlibrary loan services. So as long as users are willing to wait longer for information, it may be possible to obtain access to materials in this way. And finally, I included resources related to AMA style, which is the official style that all MTs follow. I also included a link to purchase the Book of Style for medical transcription, since I couldn't locate any current free versions. My resource guide would either be its own web page in the form of a webbibliography, or as a PDF file that could be posted to other websites and saved and shared among transcriptionists. One option would be to post the link to the guide on the MT Stars website. Monthly visits average around 3 million, so it seems likely that the guide would be noticed if it were posted in the discussion threads on MT Stars. Another option would be to reach out to the webmasters that run some of the relevant bibliographies used by transcriptionists. Many of them have sections titled Useful Links or something similar, so a link to the resource guide could be potentially placed in these sections. And finally, the guide could be directly distributed to users. I would have already established what this project is about with a group of transcriptionists, and I would assume that they would have at least a passing interest in the product I created. So a link to the resource guide could be sent to that group of MTs, who could then share it with others in the transcription and related fields as they see appropriate. To determine whether or not the resource guide was helpful for members of this community, I would follow up with the group of MTs who took part in the needs assessment. They would be asked to complete a short survey about the guide, and I've included some of the questions here. Their responses would provide me with a good idea of how successful I was in selecting sources for the guide. And I would also monitor web traffic if it was a web page. I would be able to see how many people are visiting the website, how long they're staying on the website, where they're from, and which links they're clicking most often. I would keep an eye on relevant threads of MT Stars to see what transcriptionists are saying about the guide, if anything. So that's my presentation. Thank you for taking the time to watch my video. I hope you found it interesting. If you have any questions, feel free to ask on the discussion boards.